Good evening and welcome to the information session titled Navigating the Affordable Care Act in New York State. My name is Helene Dillard and I'm the statewide director for Cornell University Cooperative Extension, and I'll be your moderator for the panel this evening. I ask that you please silence your telephones so that we can remain focused on our discussion. And this session is being live streamed to various locations across the state. It is also being recorded so that people who are not able to come tonight can access the information. This information is hosted by the New York State Department of Health, the United States Department of Health and Human Services, Cornell University, Tompkins Cortland Community College, Tompkins County Chamber of Commerce, and Cornell Cooperative Extension. I want to give a very special thanks to the staff here at TC3 who have been incredibly helpful as we planned the event and who have been extremely welcoming on many fronts. So thank you very, very much for your hospitality. Our format this evening is to begin with 3 speakers who will provide very clear information about the Affordable Health Care Act, and then transition to discussion from individuals who have already signed up. And then I will open it up for questions from the audience, and we will have our panelists respond to those questions. So without further ado, I'd like to introduce who our panelists are. The first panelist will be Dennis Romero. He's the Regional Administrator for the U.S. Department of Health and Human Services. Our second speaker will be Kelvin Sapp, who's the Project Coordinator for New York State Department of Health. And our third speaker is Jean McPheeters. She's the Health Access Navigator and the President of the Tompkins County Chamber of Commerce. We hope to then have questions and answers somewhere around 7:30 or so. So with that, I'd like to get started and have Dennis start off with his presentation.
Good evening, everyone, and thank you for coming here today. On behalf of the Secretary of Health and Human Services, Kathleen Sebelius, and Dr. Torres, who is our Regional Director for HHS Region 2, which encompasses the states of New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands, they both extend their hellos to all of you here. I also want to take this opportunity to thank everyone who collaborated to bring this event to fruition. This speaks volumes, and I said this at an earlier event today, that we all need to pause and take stock of what is happening. This is a monumental seismic shift in the delivery of healthcare. And what I would like to do in my brief presentation is just provide a quick overview, the 50,000-foot view of where we are. And then we can get into more of the New York State specific activities. So the Affordable Care Act in the context of healthcare reform. The facts across the nation are staggering. Because SAMHSA, the agency that I represent, has an emphasis on behavioral health, mental health, and substance abuse, I wanted to give you a quick snapshot of where we stand in terms of behavioral health and healthcare. We know that by 2020, behavioral health disorders will surpass all physical diseases worldwide as a major cause of disability. We know that among persons ages 12 and older who use pain relievers non-medically, in the past 12 months, 56% got the pain relievers they most recently used from a friend or a relative. We also know that half of all lifetime cases of mental illnesses begin by the age of 14 and 3/4 by the age of 24. Which essentially tells us that we have a very short window to access and provide care for those who need it the most. We also know that from the time that someone in the behavioral health realm experiences the first psychiatric break, it takes 6 years before they actually receive care. And so there are a lot of issues here that impact all of us in one way, shape, or form. And then the last thing that I want to bring to your attention is that one estimate puts the total economic cost of mental, emotional, and behavioral health disorders among our youth at approximately $247 billion annually. So what is the problem? What was that brought the healthcare reform to its current trajectory? We know that insurance companies had reign to take advantage of you and could discriminate against the 129 million Americans with pre-existing conditions. We know that premiums had more than doubled over the last decade, while insurance companies showed tremendous profits. We also know that 50 million Americans were uninsured, tens of millions more were underinsured, and those that had coverage were often afraid to use it because of the cost associated with it. Here's a quick snapshot of where we stand in terms of those receiving access to care. When we look at these five chronic diseases, we look at mental illness, for example. There are approximately 45.9 million people across this nation who have any form of mental illness, and yet out of them, only 39.2% receive treatment. When we look at substance abuse disorders, 21.6 million of them are in this country, and yet only 10.8% receive treatment. When we look at diabetes, heart disease, and hypertension, we see that the number of folks who actually receive care is much, much larger. Yet the other reality that this slide does not show is that when we look at mental health and substance abuse, the services are not necessarily the best. This is a service, not the service. And so we have a huge problem when it comes to looking at co-occurring disorders, whether it's physical and an emotional disorder. We also know that the cost associated with treating only a health physical disorder and ignore the psychological or emotional disorder tends to quadruple the cost of care for that individual. And certainly the quality of life for that individual also is hampered. When we look at the rising numbers of the uninsured between 1980 and 2010, this graph clearly shows where we've been headed in terms of the numbers of the uninsured in this country. And yet we know that this same group of people have a primary care provider that we all support, and that is the emergency rooms, which happens to be the most expensive form of care, the most expensive form of medicine to provide, and yet that medicine is not in continuity. The provider who sees that patient in the emergency room does not have a good history of what happened to them last month, 6 months, or a year, or 2 years ago. So we fragmentize the care for the uninsured and underinsured. And we also know that the cost continues to rise. This is the projected spending of healthcare as a percentage of the gross domestic product. And you can see again that when we look at Medicare, Medicaid, and then we look at all other healthcare costs, the trajectory is quite compelling. So it's human nature to want to put our arms around very complex topics. When we think of healthcare reform, when we think of the Affordable Care Act in particular, it is a very complex, very, very difficult topic. And it's human nature to try to wrap our arms around this. And so growing up, I learned that there's nothing better than a good picture to sort of capture, crystallize, synthesize complex topics. So I came up with a wonderful picture to sort of speak on the Affordable Care Act, and I think you will all agree with me. This is the Affordable Care Act. It's complex. It's challenging. It requires tremendous amount of education, tremendous amount of review. This, by the way, is an actual diagram of a colleague of mine from the Defense Department when they were looking at Afghanistan's approach to gaining the stability in that region. So we know that the healthcare law is complex. I am the first one to say that we could do a better job of communicating, but I think that we are getting our act together even more so now. We know that the message needs to get out. Access to healthcare is a right of every citizen across this nation. So in 2010, President Obama signed into law the Affordable Care Act. But what happened with that signing? I'm going to touch on some of the key aspects of the law that you may or may not know of. For example, every insurance company will have a Bill of Rights. But their Bill of Rights does not necessarily coincide with the Bill of Rights of another insurance company because they may have different priorities, a different focus. So the Affordable Care Act attempts to bring a common playing field when it comes to a Bill of Rights. So for example, it no longer allows companies to deny coverage to children because of a pre-existing condition, or putting a lifetime cap on how much care they will pay for if they get sick. Cancel the coverage when you get sick again. Also, persons will have the right to external appeals for decisions made by insurance. For example, for length of stay, continued care. You can now use an emergency room outside of your plan's network without fearing extra charges will incur. Women will have direct access to OBGYN without a referral. Enrollees must have a choice of primary care physicians. To me, this is the benchmark or the foundation on which the entire Affordable Care Act stands on. 10 essential health benefits. What the law says is that regardless of the insurance provider, the insurance carrier, they must have, at a minimum, these 10 essential health benefits: ambulatory patient services, emergency services, hospitalization coverage, maternity and newborn care, mental health and substance abuse disorders, services including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services, pediatric services including oral and visual care. These are the minimum that the insurance carrier must have. Now, where the competition comes in is where they will add something else to make it more attractive to you. The other piece about the law is that prior to 2010, insurance had what was called a 60-40 rule. Essentially, companies could spend as much as 40 cents of every premium dollar for the company itself. Today, under the Affordable Care Act, we switched that 60-40 rule to an 80-20 rule, meaning that insurance companies must spend at least 80 cents of that $1 on your health care and use the 20 cents towards the agency, the organization. Before, insurance companies could raise your premiums by double digits without justification. Today, that is no longer possible. Insurance companies must publicly justify their cost if their cost will rise, or your premiums will rise by 10% or more. There is a national watchdog that is now monitoring that and they have the ability to provide sanctions to an agency that does not adhere to this portion of the law. Before, small businesses paid an average of 18 cents more for health insurance. But today, small businesses can get a tax credit to help pay for coverage for their employees. That's another way in which we are bringing parity to this issue. Young adults under the age of 26 can now stay in their parents' health plan, which is something that was not possible before. And then this is a very quick snapshot of the preventative services that are now required. Essentially, what we're doing is we are moving the care of medicine, the practice of medicine, away from a chronic disease model to rather to one where we're looking at prevention and wellness. So part of your requirement or part of your plans will now include a whole host of preventative screenings, which aims at addressing issues further up the stream as opposed to when it becomes a dire situation, which then obviously becomes a more costly endeavor. So no matter your circumstances, if you start a new business, change jobs, move to another state, or retire early, you will have access to affordable health care beginning in January. So to make sure that we're all on the same page, we have to remember that the law is not completely new. It builds on the system we have and allows you to keep the coverage you have if you like it. The law gives states significant flexibility, as in New York, in implementing the law. If states, there are states who decided not to take their own path, and so we have come in and provided what we call the federal facilitated exchange system, similar to what New York has, but in this case, we are setting up the parameters for those exchanges. And the law does not add to the deficit. According to the Independent Congressional Budget Office, the law is paid for on its own. So in conclusion, and I know I've gone really fast, what does the Affordable Care Act do? What is that paradigm shift that is occurring? We're moving to quality rather than quantity. We're moving to integration rather than siloed care. We're moving to prevention and wellness, as I said earlier, rather than illnesses. And access to coverage and care rather than significant parts of American uninsured, which is part of the parity issue that I did not cover as much. And we're focusing on recovery rather than chronicity or disability. And we look at cost controls through better care because of the prevention emphasis. So I thank you very much for this time. And again, I thank all those who participated to bring this program to fruition. And I look forward to having dialogues with all of you. Thank you very much.
Thank you. Our next speaker is Kelvin Sapp. He's the project coordinator for the New York State Department of Health.
Good evening, everyone. Try to get closer to the mic here. So as you all know, on October 1st, New York State opens its doors officially for individuals and small businesses to begin to enroll in qualified health plans. And this began the first open enrollment period, which will run through March 31st of 2014. I'll talk a little bit more about dates that you need to be aware of as we go along. So what is New York State of Health? It's an organized marketplace where individuals, families, small businesses can shop for affordable health insurance. The idea here was for there to be one system, sort of a one-stop shopping system where individuals can apply for Medicaid, Child Health Plus if they have children who are eligible for or needing insurance, and then also qualified health plans, which I'll show you as we go along. The marketplace, as we call it, is, many of you are familiar with the term health benefit exchange. We use the term marketplace now, so the marketplace is the only place where individuals and small businesses may come to qualify for tax credits, and we have made it possible for individuals to apply online through a web portal by calling our customer service call center or by using the services of one of our in-person assistants. And again, I'll get into this in a little bit more detail later on. The marketplace is divided into two different components. We have the small business marketplace. Small businesses in New York State is being defined as 50 or fewer employees, so basically 2 to 50. We're talking about sole proprietors who would have previously shopped in a small business marketplace will now shop in the individual marketplace. And so, that's the other component, the individual marketplace. Again, this is where individuals, families, and sole proprietors can come to shop. Over the course of the first 2.5 to 3 years, we expect that about 1.1 million New Yorkers will come to the marketplace. The bulk of those will be in the individual and families marketplace, about 615,000, and then we have about 450,000 that we expect to come from the small business marketplace, representing about 100,000 small businesses in the state, averaging 4 to 5 employees. Here's some other information that you might want to know. We, at the department, contracted with an organization called the Urban Institute to help give us an idea of who it is we could expect to come to the marketplace. There's a lot of other data that's available that I'm not sharing here tonight, but certainly can make available to you if you're interested at a later date. But they gave us some idea of who we could expect to come to the marketplace. Some of the characteristics are what you're seeing here. We expect that about 3/4 of those who come to the marketplace will qualify for some form of tax credit to help help them to pay for their coverage. Nearly 35% will have a primary language other than English. We expect that 58% will be white, non-Hispanic, and 42% will represent other races and ethnicities. And again, I've talked about the small business piece here. So back to some of the dates that I mentioned earlier. So October 1st through March 31st, 2014 marks the first open enrollment period for New York State of Health, unless an individual has a qualifying event. So if someone has not enrolled in a plan by March 31st, and they have a qualifying life event, such as a marriage, birth of a child, loss of coverage, et cetera, they relocate, for instance, to another state. Those types of things would initiate a special open enrollment period for those individuals. Of course, small businesses will continue to enroll their employees throughout the year, each month, as they typically do now. Also, those who are enrolling in Medicaid and Child Plus can enroll throughout the year. Okay. It is very important that people remember these particular dates. December 23rd is the date by which everyone must enroll in a plan if they expect to have coverage effective on January 1st. So previously, you may have heard December 15th was the cutoff date to have January 1 effective coverage. That has been extended out a week. So December 23rd is the date by which everyone must have completely enrolled in a plan if they expect to have coverage effective on January 1st. That deadline for small businesses was November 29th to have effective coverage for January 1st. Okay? And basically the rule is if you want to have coverage by the first of the upcoming month, you must have enrolled in a plan by the 15th of the month that you're in. So if you want coverage for February 1st, you need to enroll by January 15th. If you want coverage by March 1st, you need to enroll by February 15th. Is that clear for everyone? All right. Just want to make sure everyone has those dates in order. Of course, as I said, if you haven't enrolled by March 31st and you don't meet, if you don't qualify for a special open enrollment period, then you'd wait until the next open enrollment period, which, as I understand, will be November 15th, 2014 through January 15th, I believe it is, 2015. All right. So in order for people to enroll, the state created what we believe is a state-of-the-art web portal whereby individuals can go online from their homes. You can sit at your kitchen table or at your desk, your office, in your home, and enroll in a plan there if you so choose. It will allow people to easily compare the various plan options. They'll put in some basic information that they need regarding the people in their taxable household, their annual taxable income, those sorts of things. Information, of course, will be verified, but they'll go in and create an account, put in the information. They'll see what the various options are in the county in which they reside, and then they'll be able to select a plan. Of course, individuals are not left alone to do this. As the schematic that he showed earlier, this whole thing tends to be very complicated, and so we have assistance available. If an individual is trying to enroll through the web portal and gets stuck, there's an online or live chat feature that they can use. Of course, they can also pick up the phone and call our call center and get assistance. Those call center representatives should actually be able to tap right into the application that's being completed at that time and help the individual. And also, if you start an application and you realize, hey, I don't have everything I need at this exact moment, everything gets saved, and you can come back and pick up where you left off at a later date. Actually, I wanted to share make sure I got the numbers right here, just so that people understand that New York State of Health is moving on, and we have people that are enrolling. Right now, as of December 1st, we had over 91,000 individuals who had completely enrolled in a health plan, and we had nearly 285,000 who had completed an application. That means that they've gone through the process, they know what they qualify for, if they're going to receive tax credits or cost-sharing subsidies. I'll talk about that a little later. They know exactly what they qualify for, so they've gone through that whole process. What they have not done yet is selected a plan, so essentially they're shopping around to figure out what's best for them or their families. But we have, like I said, 91,000, over 91,000 who have actually completed enrollment, meaning that they have coverage that's effective January 1st. And we're getting, especially this week, the call volume, the call center, and people enrolling. It's been a lot of heavy traffic. So things are moving along. All right. I mentioned this earlier, so I won't go through it again, but Medicaid, Child Health Plus, and one of the qualified health plans people can enroll in. Accompanying the web portal, we have a first-class customer service center that's operated by Maximus. As I said before, these individuals at the call center are available to answer people's questions, but beyond that, they're actually able to take applications over the phone. So if an individual says, hey, I'm not so tech savvy, I don't do the computer thing, I need help, I want to enroll, they can actually call this toll-free number, which you see here, 855-355-5777, and speak with an individual who can help to complete an application for them over the phone. You see the call center hours here, Monday through Fridays. Hours are 8 a.m. until 8 p.m. and Saturdays from 9 a.m. to 1 p.m. I'm trying to remember, actually, I know that the Saturday hours have been expanded, I believe, until 5 p.m. just for a short period, trying to get people to that January 1 date. So, and then it'll go back to these hours that you see here. We expect that the representatives in the call center will speak multiple languages, so many of them will be bilingual. And we know that New York is a diverse state, many languages spoken. You saw already some information about that. Beyond the languages that are spoken by the representatives, the state has contracted with Language Line Solutions to be able to provide telephonic interpretation services for other individuals. So in essence, virtually any language that people in New York speak will be available for assistance. So over 170 languages through Language Line Solutions will be available, and staff should be able to get the help that they need. Consumers should be able to receive the assistance that they need. And then along with the web portal, and so I've talked about 2 ways that people can enroll or get assistance, get questions answered. Third way is to contact one of our in-person assisters. We have certified enrollment experts who are available throughout New York State. So in every county of the state, we have assisters available on the ground who can answer questions and who can actually stand in as a proxy and complete an application for an individual as well. So let me talk a little bit about the 3 different types of assisters that we have available. We have our navigators first off, and the navigators will help to complete applications. As I said, they will serve individuals in both the individual marketplace and the small business marketplace. Navigators have received funding from the state to do the work that they're doing. So I think the state gave out about $27.3 million to 50 primary organizations, and I think there were 96 subcontracting organizations who have hired individuals who are now trained and certified to provide enrollment assistance. So again, they've gone through extensive training and certification and should be credentialed as they come to assist you. As they're being compensated by the state, they're not charging individual consumers to provide assistance, something that's very important. In fact, I'll just say it right now, none of our assisters will be charging individuals to provide assistance. So that's something that I just want to make clear. We have insurance brokers and agents who are also available to assist. They can complete applications, again, serving individuals in both marketplaces. These insurance brokers and agents are receiving their pay from commissions that they receive through the health plans. Again, they've gone through extensive training and certification as well. And then we have certified application counselors who are able to help complete applications, but only in the individual marketplace. So they will not be serving small businesses. There is no direct funding stream for these individuals, so the state has not provided any funding for certified application counselors, although many of them may have sought funding elsewhere to help them do this work. We expect that oh, at this time, many of those certified application counselors are undergoing training. Priority has been given to like healthcare providers, some of the health plans, basically some of the organizations that have had some financial interest in helping people to get insured. So someone goes to a hospital, they don't have insurance, perhaps they're going to be taken care of, and charity care may be covering. As you can imagine, those hospitals are very interested in helping those individuals to get enrolled in a health plan. So that's where priority has gone, but we will continue to train other organizations that are interested in this work as well. It is a job. It's not something that's very light. So if people think this is just to help do outreach, now the expectation really is that applications are being completed. They need to have the technology and the space available to service individuals. All right. I should also mention that in addition to these assisters, the federally qualified health centers have received funding to help get applications completed as well. So, I mentioned qualified health plans. I just want to show you here quickly that these are the health plans that are in the marketplace that have been approved to provide a health plan in the marketplace. Not all of these health plans will be available in every county. So we have resources online. You see this link here where we have a plan map. You can click on your county and you'll see all the plans that are available in a particular county. In addition to the health plans, we have qualified dental plans that are available, and these are the options in the marketplace. I won't go over the 10 health benefits because you've heard that already. Just want to mention that plans are offered at 4 different levels. We have platinum, gold, silver, and bronze level plans, each of them carrying an actuarial value, which basically tells you what percentage on average the health insurer will pay versus how much the individual would pay out of pocket. So at the bronze level, 60% on average will be paid by the insurer, 40% by the individual, and that goes up 70% at the silver level by the insurer, 80% at the gold level for the insurer, and at the platinum level, 90% on average will be covered by the insurer. Again, each of these health plans or health insurers had to show proof that they had an adequate health network, so provider network, and also hospitals, etc. And again, of course, all of these state consumer and provider protections are in place. For young adults, which I was expecting this to be a young adult audience, getting a lot of the students in here, there's another plan that's called the catastrophic plan that is available for those 30 and under. It's sort of a starter plan, if you will, for those who would say, I'm not at that place right now where I can pay a premium, one of these premiums, but I do want to have something in the event of an emergency or something along those lines. I will stress, however, though, that even the young adults can come to the marketplace and potentially qualify for tax credits and find that they may actually be paying a lower premium for a plan that offers all the benefits that I mentioned earlier or that you've seen earlier. It may be actually cheaper than what the catastrophic plan would be. So it's worthwhile to check those out. Let me see here as I move along. I don't know what we have in the way of people interested in considerations for farmers, seasonal workers, or migrant workers. But the basic message that we want to give is that everyone should come to the marketplace to see what it has to offer for them. In New York State, we expect that there's something available for everyone, whether it's emergency Medicaid or, like I said, Medicaid and Child Plus. Those types of options are available. So the key message here is to come to the marketplace and see what you're qualified for. All right. This is just an example. I won't walk through every little detail of the example, but just to give you an idea of several counties and what the tax credits might look like for individuals. So these examples were done looking at silver level plans only. So for an adult earning $20,000 in Cortland and Tioga counties, for instance, the tax credit available would be about $273 a month. That tax credit could then be applied immediately, giving them the option of health plans starting as low as $68 a month. And you see a similar example here for Tompkins County and for Albany County. So we can talk about that more if you have some questions. Here's a similar example that looks at a family of 4. That's 2 adults and 2 kids. Those are the number. That's what I put into the calculator when I did this. But you get the idea in Tompkins County for a family of 4 earning $50,000, $522 a month, tax credit available. Parent premium would be about $329 a month, and $18 a month for the children. So this is just to give you an idea. And again, we have a tool on our website that you can play around with right now called the Tax Credit and Premium Estimator. You can put in some figures and it'll give you an idea. It'll show you all of the health plans in your particular county and what the premiums are for those health plans so you can make an informed choice. In addition to tax credits that I've talked about, there are also cost-sharing subsidies that may be available. These are to help to reduce the cost of some of the out-of-pocket expenses, such as co-pays and deductibles. And so here's some information that gives you an idea of income levels where people might qualify. For the cost-sharing, single adults earning less than $28,725 might qualify. Families of 4 earning less than $58,875 might qualify. You see the numbers for those who might qualify for tax credits. This is what that tool looks like that I just mentioned to you. So again, it's fairly simple. Number of people in the taxable household, number who are seeking coverage, number of children between 19 and 25, number of dependents under the age 19. You put in your income, taxable income for the year. You'll select the plan level, and then you'll select the county in which you reside. And then it'll tell you kind of where you fall on the federal poverty scale, and it'll show you what the tax credit is that you will receive each month to help cover the cost of your premium. If you were to scroll down, this is just a screenshot. If you were to scroll further down, that's where you will see all of the health plan options for that particular county, their premiums alone, and then you would see what their premiums would be if you applied your full tax credits. All right. You all have seen a lot of the media stuff. You've seen the advertisements that are out there. We have our social media pages that are available. We have our Twitter, our Google Plus, Twitter, and I said Twitter, Facebook, YouTube channels. All of those have been active and working, and we're getting quite a bit of activity on each of those, particularly Facebook. A lot of people asking a lot of their complicated, specific questions on Facebook, but all of them are getting answers. And so we do have people who are answering all of those questions. So those forums are being used. You'll start seeing some of the out-of-home advertisements, so the billboards, the bus transits, those types of things. Those are coming out if you haven't seen some of those. So a lot of efforts underway to make sure the word is getting out about this. These are just some samples of our materials that are available, some of which are on the back table there. So we have rack cards, we have posters, smaller posters and larger posters, and then we have some fact sheets that are available. We have an order form that's on the website that you can use to order materials at no cost. So you can go on our website, fill out the order form, email it to the appropriate place. You'll get a response within a day or two, letting you know that your order is being fulfilled, and within a week or so, you should have your materials, again, at no cost to you. There are some limits on how much materials you can order at one time because we don't have an unlimited supply, even though we continue to replenish. Right now, it's just primarily been the English materials that are available, but we do have materials available on our website in 7 other languages. Don't know if I'll remember them all off the top of my head, but certainly Spanish, Korean, Chinese, French, Haitian Creole. I know I'm going to forget something, but anyway, there's 7 different languages, and those materials will soon be available in our distribution center as well, I think probably within the next couple of weeks. So those will be available for order, but right now they're in PDF form and can be downloaded. I will stop there, and it's a lot of information, so thank you.
So that's the website that we would go to, the one that's up.
Website.
Okay. And that's a toll-free number underneath.
That's a toll-free number for the call center, and again, all the materials in the back have that information on it, so you'll be
Okay.
able to get it.
Thank you. Our next speaker is Jean McPheeters, and she is the Health Access Navigator and President of the Tompkins County Chamber of Commerce. So we've heard from our federal partners, our state partner, and now we're into the county level. Thank you, Jean.
Thank you. Good evening, everyone. You have heard every fact, and I'm going to try to talk really about what it's like to try to apply, because it's way more interesting. So I'm going to tell you a little bit about why the Chamber got involved in this. About a year and a half ago, we had the opportunity to apply for a grant to go out and start to talk to people about the Affordable Care Act. And the fact is, most of us have gotten our insurance over the years by our employers. We went to work, we got a job, we went into our HR office, the employer said, fill out these pieces of paper, and suddenly we had insurance. We never thought about it, we didn't know what it covered, we just had it, right? And suddenly this was going to be really different. And representing a group of employers across this county, I really wanted to be able to explain to them what the Affordable Care Act was going to be and what the mandates were going to be for small employers and for large employers, and understand how that was going to affect their employees. Because regardless of what happened, employers were going to go and ask their employers how this was going to work, right? So employers needed to know about it. So we got this Navigator grant, and there are lots of other local agencies that are now navigators. The Cortland County Chamber, the Human Services Coalition, in Tompkins County, a thing called the Southern Tier Independence Center, which is operating out of Tompkins Community Action. I wish that we got really good hats. I figured if you were going to be a navigator, you should get a good hat, but we didn't. So what do we do, since we don't have a good hat? We educate and assist. We answer questions. We have a lot of information. I have a lot of knowledge, and all the people that I work with have been trained. We guide you through the website. We sit there and we just do the whole thing for you. But we help you celebrate, because there are celebration points, like your identity is verified. That's a point for big celebration. When you actually get to choose a plan, that's another point of great celebration. You know, so there are moments that we can jump up and down together. What we don't do, we don't tell you which plan to choose. In Tompkins County, if you're an individual and you came in and you didn't have any choice, you didn't know what you really wanted, there would be 30 plans that would come up, and you'd think, oh my God, right? You'd think, this is hopeless. So there are tools on there to help you winnow down what you're looking for. As Kelvin explained, there are these 4 different levels. So there's platinum, gold, silver, bronze. The basic difference is, if you choose a platinum plan, you have very little out-of-pocket expenses. You have no deductible for most of those plans at all. But you are going to pay some when you go to see the doctor, and your premium is going to be much higher. If you choose a bronze plan, you're going to pay a very large deductible, and you might not have to pay very much when you go to see the doctor so much, but the chance of you getting through your whole deductible is slight. So it's that choice about, and I think I talk about it as in terms of risk tolerance. What can you in the pit of your stomach, what do you feel okay about? What can you cope with? And I try to explain it to people that way. Because I think actually if you sat there and you added all the figures up and you figured about your out-of-pocket, your maximum out-of-pocket, your deductibles, it all comes out to about the same amount of money every year. If you you had a horrible car crash and you ended up, spending everything, it would probably be about the same amount of money. It's just about how you lay it out and what you can afford. Can you afford to spend it, up front? Or can you afford, do you want to spend it on your premium, or do you want to spend it when you get sick? That's the choice. So it's really important for people, I think, to begin to understand that. For many of the people who come in to see us, I'm using words that they're just not familiar with. They haven't thought about what really a copay is versus a deductible versus maximum out of pocket. And so I've had to explain that to a lot of people in detail, what those things are. So that's how we talk about what your needs are, and we ask good questions. One question we often ask is there a doctor you specifically want to see? And there's a way on the website you can put in your physician, and then it will say, you put this in, and then it will come up with a list and say you choose one, and they say yes, and you've chosen maybe MVP, and it will say yes, they're in the MVP plan, or no, they're not in some other plan. So it's really important to do that. There's also an option to do that for hospitals. You can also go if you're really concerned, because we all have learned sometimes that what's on a website, it may not always be 100% accurate. You can actually go and look at like MVP's or Excelis's website and check further into that, and also check through formularies to see if there's a particular prescription you take that may be terribly expensive. You may want to check and make sure what is the cost under the particular plan you've chosen. So Kelvin explained a little bit about tax credits, and I really want to emphasize what he said about how tax credits are applied right when you buy them. Because most of us think about a tax credit that you get a year and a half from now when you file your federal income taxes, right? Well, which would do most of us no good. If if our tax bill was $800 and we had a tax credit of $400 and we were going to get it a year and a half from now, it's of no particular use to us. But the fact that it is right when you buy your insurance and it comes off makes an enormous difference. The tax credit that's available to businesses does come when they file their insurance. So here's the difference, and this is the thing that a lot of small businesses have had to cope with this year to think about. There are tax credits that are available to small businesses that have fewer than 25 employees. They also have to pay they have to pay at least 50% of their employees' premiums, and they have to have an average income, a salary level of $50,000 or less than $50,000. And you can exclude the owners of the business when you're doing that calculation. So this tax credit is up to 35%, and it's going up to 50% next year for-profit businesses, and 25% and 35%, 25% this year, 35% in the coming years for not-for-profit businesses. You may ask, how do not-for-profit businesses get a tax credit if they don't pay taxes? They get it because the tax credit comes off of their payroll taxes, okay? So, it's really important that people understand about this tax credit. So the small businesses are in this situation of thinking, what's best for me and what's best for my employees? And really, I have to tell you that that's exactly how most small business owners think. They really want to think about what's best for their employers and their employees. So so here's the issue. Maybe they would just want to get out of the whole out of the whole health insurance business whatsoever. I mean, it's a lot of work, and if you don't have an HR department, it's a lot of work. So if you were a business of maybe 7 employees, you might think, I'm just going to get out of this. I'll pay everybody like $1 more an hour, and they'll buy their own insurance, and I won't have to think about it. And that might really work. If you had employees who were earning $20,000 a year, it would work very well because they'd get a good tax credit. If your employees, though, earned $45,000 a year, they're not going to get a tax credit, in essence. It's just not going to happen. So in all likelihood, as they were individuals, if you looked at the big family, maybe they would, but in all likelihood, they're probably not going to. So at that situation, the employer may think, well, maybe I'm going to go and offer insurance. Because the real reason that employers offer insurance is it helps keep a better qualified workforce. It's a big benefit. It's something you don't have to think about anymore, and employees like that. So this is sort of the background buzz that's going on in small businesses right now about trying to make that decision about how do I choose to stay in this business or to get out of that business, and what's best for both me as an employer and for my employees. Other things that are really good. So how the tax credits are applied, what insurance companies are in the marketplace. In Tompkins County, there are 3 companies that are offering plans. Those are Excelis, MVP, and Today's Health. They all have networks here. Most of you probably know Excelis. It's probably been the one that's around here the biggest. It has a very robust plan. MVP has really built up its plan. Today's Health is a new plan that's sort of coming across the state and is beginning to build its network. So, and when you look at the prices, they're slightly different. And they're different at all of the levels. So it's really important to look at all of those plans and decide, again, what's best for you. What happens if I'm eligible for Medicaid? I love this about this system. Because before, you kind of had to know that you were eligible for Medicaid to go and apply for Medicaid, you know? You're like, this thing, it like says, okay, so you're eligible for Medicaid. What some people don't like is they don't want to be eligible for Medicaid. But you don't have a choice in this plan. If you are eligible for Medicaid, that's the system that you're going to be on. You can't say, I don't want to be eligible for Medicaid. I'd rather take this particular plan. You could, but you would have to lie about your income, and that is called fraud, and I don't recommend it unless you look excellent in orange. So that's really all that I have. I'm just going to spend a minute talking to you about what happens if you come into my office and talk with me and to enroll. So you call, you make an appointment. We have myself and 2 other people in my office who are gone through the classes and are certified navigators. There are also lots of other people in this county and in Cortland County and elsewhere. In this county, if you call 211, the Information and Referral Service, they can make you an appointment and get you to the right place. If you come in and see me, we're going to sit down, and I'm going to say, tell me about the insurance you currently have, and then we're going to start in on this thing, and we're going to go in and we're going to verify that you are who you say you are. We're going to put in your address. Generally, just by putting in your address and your social security number and your date of birth, the system recognizes you. Sometimes they ask you a series of sort of silly multiple choice questions that say, in 1984, you got a car loan, and choose a bank that you got it from. So it's sort of verifying, because it's bouncing off one of those companies that does something with your credit cards. What do you call those companies? You know what I mean? Like it's not Expedia, it's Exterion, it's something like that. Experian. It's bouncing off one of those, so it verifies your identity. Then it says, congratulations, you are who you say you are. And we go on and we put in more information, and then it starts asking you about to build your family. So if I came in, I'd do it for myself, and then I would add my husband, and I would add, his birth date and his social security number and whatnot. If I had a child, I'd add a child. Then it asks you, what is everyone's relationship to each other? So like, Daniel is the spouse of Jean. Jean is the stepchild of so-and-so. You do that kind of thing. Then you've built your household, and you say, yes, everybody lives at the same household, because it's about how you file your taxes. Then you go to the next stage, and it says, tell us what you earn. It asks a question, essentially, do you earn the same this year as you earned in 2012? It may ask 2011 if you haven't filed your 2012 taxes. But it says, are you thinking that you're going to earn in 2014 what you earned in 2012? And you say yes, no, or I don't know. And yes is essentially like within 10%, and then it says, if you think that's what you're going to earn, and sometimes you have a very complicated system, you may have to add, like, if you're somebody who has a lot of income from a lot of different sources, it may take a while to get through this, because you're going to have to add some different sources of income, and then, like, if you're paying alimony to somebody or something else, you've got to stick that kind of stuff in. But then it will come out to this point, and it will say, okay, so we think your income is this, your family size is that, congratulations, you're going to get a tax credit of such and such an amount. The tax credit is the same no matter which level of health care you choose, the gold, platinum, silver, or bronze. It's the same tax credit. It's how you decide to apply it. So if you choose a gold plan, it's going to be more expensive than if you chose a bronze plan. Then I'll sit there with you, and we'll look at the plans, and we'll do those kind of that filtering. We'll come through some plans. I will not choose the plan for you, but we'll talk about what makes sense for you, and then you get to choose a plan, and we say click, and it says okay. And then what will happen is you'll get something in the mail from the insurance company, and you'll start getting billed. So that's how this works. We've done about, 45 of these so far. We have a lot of people in a lot of different stages. We have some people complete. There are also people who were eligible for Medicaid, and Medicaid didn't, things aren't really happening with Medicaid until early December, so they're still getting their information. We have, the best part for me is when somebody who hasn't had health insurance in a long time says, wow, this feels so good, because I've been gone without health insurance for 3 years or 4 years or 5 years because I have a health condition, I haven't been able to work, or I work part-time and my employer doesn't offer health insurance. I can't tell you how good it feels. Or I've had health insurance, and I've had health insurance for years, but I know I qualify for the tax credit, and I couldn't get through this thing myself. If you're me, without training, you couldn't have gotten through this thing yourself. And God knows if you were my husband, you couldn't have gotten through it himself. So it's not insanely difficult, but it's just that kind of thing you've got to, it helps if you've looked at it 100 times, and that's what I've done. So we're happy to help. Thank you so much for the opportunity to talk with you about this. And if you want to reach me, always call me at the chamber. Thank you.
Okay, so now we've come to the part where we can ask questions. And so I think I'll open it up to the audience for any questions that are out there. And if you can say your question nice and loud, I'll make sure I repeat it into the microphone. Yes. Is health insurance now going to be mandatory?
Sure.
Your mics are all on.
Yes, under the Affordable Care Act, you are required to have health insurance.
And what happens if you do not sign up? Let's say you just can't do it and...
There's a fine. There's a fine. So if you don't sign up by end of next March, when you file your taxes for 2014, there'll be a question on your tax form, your IRS tax forms that say, do you have health insurance? And actually, if they will know frequently through an employer and through this system, because on your W-2 forms, your employers are going to have to report what they're paying for health insurance for you. So that's how the government knows that, and then they know if you've signed up through the system. If you don't, the fine is 1% of your income with a minimum of $95.
And then in the subsequent years, it goes up.
It goes up.
2%.
It goes up 2%
and
and 3% in the third year.
Yes.
Are employers required to offer insurance to their employees?
Question is, are employers required to offer insurance to their employees?
Let me start.
If you said from the W-2 form, it will indicate
Right.
what insurance your employer is providing for you.
It depends how many employers you have and how many employees you have. So if you have fewer than 50 employees, there is no mandate to offer insurance. If you have 50 to 200 employees, you are supposed to offer insurance, but if you don't, you can pay a fine. And for some employers, that's what they may decide to do. And if you have more than 200 employees, there's a sort of an affirmative obligation to enroll your employees in health insurance. And if they want to opt out of that health insurance, like say you worked for
TC3.
Say you worked for TC3, exactly. And you meet the requirements at TC3, like you work, 30 hours a week or more to get health insurance, or whatever it is here. If they have to enroll you in health insurance, but say you get insurance through a partner or a spouse, okay, somewhere else, you can then sign out of getting health insurance here and say, I get my insurance through my partner or my spouse. Does that make sense?
Yeah, I was just thinking then, where does, yeah, thank you.
The other piece to this puzzle that I think it's also important to take note of is that prior to the Affordable Care Act, you as a prospective employee of Agency X, you decided on joining that company, that organization, among other things. Part of your decision-making itinerary included, well, what are the benefits that they're offering me, aside from salary and compensation? So the health benefits become an important decision piece to that puzzle. What the Affordable Care Act has done is that that part of the negotiation is now somewhat moved from that employer and applicant process, so that as a prospective employee, you don't have to include the benefits anymore as one of the variables in deciding you're going to join this company or not. And if you think about it, that can have a huge impact. And so in terms of you looking at the quality of life in that employment, in terms of the work-life balance, it has a lot of rippling effects. So it's more than just a simple, quick answer to a lot of these complicated questions, as I said earlier, because our health impacts a whole host of areas in our work life, in our professional life, but also in our personal lives. So that's something to be mindful of.
Next question. Any questions? Yes, in the coat.
If your employer offers health insurance, but say perhaps you find it too expensive for you, are you able to use the exchange instead?
So the question is, if the employer offers health insurance, but that is going to be too expensive, can you then turn to the Affordable Care Act?
Okay, so here's the hopefully simple answer to that question. Basically, anyone can come to the marketplace to shop for coverage. But the Affordable Care Act has set an affordability standard, which says that no one is expected to pay more than 9.5% of his or her income towards insurance. So if you are working for a company and you're paying more than 9.5% of your income towards coverage, that's the time when you might consider coming to the marketplace to look at what might be more affordable coverage for you. Now, if you have affordable coverage from your employer and you chose to come to the marketplace, you can still do so, but you would not qualify. There's no opportunity for you to qualify for tax credits that might help you to pay for those premiums.
Right.
And you may recall that today, my wife, for example, she does not participate in her employer's health plan. She chose to stay with the health plan that I have. It's not any different once the implementation of the Affordable Care Act goes into place on January 1st. You still have the choice of deciding to stay with your employer or because it's less expensive than going with your husband or your wife or your partner or someone else's. So a lot of the particular milestones of the law are no different than before. I think what is happening now is that we as a society, our consciousness, our awareness of all these terms are front and center. And so we think, oh my gosh, this is new. This has to be new. I've never heard this before. It's been going on for a long time. It's just we now are playing a much more active role. So yes, you don't have to sign up. You may take your partner because it's less expensive, and we do that already today.
I have a question for the panel. Is there a maximum income for an individual that then kicks you out of the eligibility for the Affordable Care Act? Can you make too much money to sign up?
Oh, through the marketplace, you mean?
Yes.
No. No, not at all. You can sign up through the marketplace regardless.
Okay. Other questions? Yes, in the back. Yes, you.
So when you sign up as an individual through the marketplace, it sounds like your choice of plans is based on the county that you live in.
That's right.
So what happens if you then move? For example, my son lives in Brooklyn.
Yay.
He's over 26
Good
now.
place.
He doesn't have insurance, but who knows how long he'll be there. So what happens when he decides to go someplace else? And to keep it simple, let's say within New York State. So,
Yeah.
and so what happens then?
If he moves within New York State, probably his employer has changed as well, and his employment circumstances has changed. When anything like that happens, you need to go back to the marketplace and tell them, because you may have to switch plans to get coverage, to get a network. I mean, if say for instance you were in Brooklyn and you were covered by, I don't know, something downstate, Metro something or other, okay? And there was no Metro coverage up here, so you'd want to go to and find the new plan and switch, and that's called a life-changing event. So that's when that can happen, and he might be earning more or less money, which would also possibly change what the tax credit would be. And anytime that happens, you really need to report that, because say you were earning $24,000 a year and you got a tax credit of $350, and then you were lucky enough to get a new job and you were earning $36,000. You need to make sure that you get onto the exchange and report that, because your tax credit's going to decrease, and you don't want to end up in a situation the following April when you fill out your taxes where you're going to owe the government a ton of money.
If I can add to that just a little bit also, my understanding too, and you know this better, being in the system, but when you're applying at the point of application and it tells you this is the tax credit that you qualify for, you have the option of deciding
right.
how much of that tax credit you want to apply right away. So there are some people who might say, hey, I'm expecting that I'm going to get a new job and my income is going to increase over the course of the year so that I don't end up owing the government. I'm not going to apply the full tax credit. I'll apply this much of it and reserve this this bit here. So people, again, it's risk-taking. People are kind of looking at their situations and deciding what's best for them, but you do have the option of determining exactly how much of that tax credit you will apply right away.
Yeah, there's a cool little slider button on the thing. Though I have found that practically everyone takes the full amount.
Yeah. I imagine so.
And I just got to chime in again. Like before, that would fall under a life qualifying event,
Right.
whether it's marriage, moving out of state, newborn, adopting a new child. There's a whole list of qualifying events that already applies today and applied yesterday. But what we're saying is that it will apply tomorrow as well.
Okay. I have a question up front.
If we live in Tioga County and we have, excuse me, please. Sorry. And we have less than 5 employees, small business.
Yep.
Do we come and see you? Can we come and see you, or do we have someone in Tioga County that we should see?
You can come and see me, but there are people in Tioga County that you can go see as well. I don't know the numbers offhand, but if you call the chamber tomorrow, I'll give you my number, 273-7080. I would be happy to tell you who it is. And so I know that there are several people there who do it. And you have 5 employees, yeah. And you don't have to offer insurance, but you could sign them up for insurance through the program.
And I have a similar question for Kelvin. So we have people that we're streaming to across the state, and there are other people that are going to look at this online. What number should they call to find out who their navigators are in their counties?
Okay. So again, you can call the toll-free number that you've seen up on the screen, the 855-355-5777. Certainly they can direct you, but if you have access to the internet and you visit our website, nystateofhealth.ny.gov, you can actually find a resource called the Navigator Map. You click on the county in which you reside, and a list of all the Navigator organizations in your county will pop up. There's also a listing of those navigators, so those are some of the ways you can get that information.
Great, thank you. Other questions from the audience? Yes.
I understand that this is going to help a lot of people, but for some since like 2004, and I spend a lot of my time in third world countries where there's no medical care and stuff. I don't understand how this is going to help me, or like, is there any other option for someone like myself?
You got us all puzzled here.
So you haven't had health insurance?
Yeah.
No.
Even though I had health insurance, I didn't go to the doctor, so I just stopped having it even when it was.
Well, my suggestion is we have to figure out a way to get you to connect with the doctor, number one. But the
I don't have anything against doctors.
no, I'm sure. But I'm just puzzled by, well, what do you do that takes you? I don't want to get personal, but I'm just wonderful. Okay, that's okay. That helps me.
People's healing.
Sure. So the missionary association. Let me talk to you afterwards, okay? Because it gets into other technicalities that we'll talk.
I have a similar question, though. As a parent, I'm living in Tompkins County, but I'm going to have a college-age son that's going to be in another county in New York State. And under the current insurance that I have through Cornell University, he's covered. But if I was on in the marketplace and I was in the same situation, how do you handle that when a parent is here, the under 26-year-old college kid is somewhere else? Is that working in the marketplace?
I would say there are some of the companies have statewide networks,
Okay.
which is very helpful in that situation. And
So when
you can look at that when you can look at the plans for that. When somebody's out of state, that's an issue.
Okay.
Because there are some companies that have nationwide networks, but they're spotty. So you really have to think about that. I think for a lot of college students, they get insurance through their college. And that may be one of the answers that people look at.
Other questions, Steve?
Suppose I have a plan and I'm enrolled and 6 months from now, I don't like it, but there are no other life-changing events. Can I?
No, Steve,
No.
you have to suck it up for 6 months. It is a good question, and
Right.
but it's sort of the same that happens if you got your insurance now through your company. You can't change in the middle of the stream.
You're committed for a year.
You're committed for the year.
To the next open
Till the
enrollment
next
period.
open enrollment period. So, you know, I think most of us have, and that's sort of why I really try to talk with people about risk tolerance, because that's what I had somebody in the other day who said, you know, I'm never sick, nothing's ever happened, and I said, congratulations, and that's really good. But sometimes, let's think about if something really bad happened. What's your financial tolerance for dealing with that? You know, if you went to the doctor and had a cancer, or you had some, you know, you had some heart illness or something, so what's your tolerance for dealing with that? And then choosing the plan that's right in that circumstance.
Other questions, Gary?
Yeah, how does the good work that you folks are doing impacted by the cynicism and political ramifications they're playing out at the federal level, where, you know, people are just, there's a certain amount of cynicism that comes into play. Meanwhile, in New York, it seems like things are going fine. How does that affect you folks, and how do you guys battle that messaging-wise and tell your success stories that you're having?
To be honest with you, I personally don't listen to all the stuff, so I don't really spend a whole lot of time listening to those things. They're, you know, certainly I'm informed on some level, so there's certain things that I see and hear, but never really focusing on it. I'll tell you, as I'm traveling across the state of New York and giving presentations to consumer audiences, to organizations, et cetera, no one's focused on those things. You know, I think those of us who are bureaucrats and working in these agencies, we tend to be hypersensitive and we think about a lot of these things, but the average citizen, as I'm finding, as I'm presenting, they're not talking about it. They really just want the information that they need so that they can enroll in a plan or get the coverage that they require. So.
We've had a few people who've been very upset, and it's probably because of their particular circumstances, their insurance is going to cost them more than they had hoped. That's the issue, I think. It's really it's a pocketbook issue for some people, and depending on how your income comes together, it can be that could be a situation. People are surprised that it works. Do you know what I mean? There's a certain surprise when they come in and we actually get through the whole enrollment in 60 minutes that it works. So there is this, because there is this sort of national buzz that says nothing works, which isn't true. Now, occasionally there are some days something doesn't work. And I try to deal with things with good humor, and we'll make an appointment and we'll come back and finish this up. Or if you give me permission, I can, figure out a couple of plans you might want to look at and mail them to you, and then we'll talk on the phone. So I think we really try to work through the issues. And I would say it's just this week that the phone lines have gotten really busy. Yeah. This is the first time I have ever encountered a delay at all.
Right.
So.
I really appreciate your question because it touches on various levels of where we are as a society. But being that we're in a academic institution, I think it's appropriate to use an academic analogy. So the one that I'm going to give you is today's philosophies are always tomorrow's common sense. What happened with Medicare and Medicaid back in the 60s and 70s, it took approximately 5 to 6 years for the nation to come to realize, because the partisan politics about Medicaid and Medicare back in the 60s, it's been told to me that it's about 4 or 5 times worse than it is about the Affordable Care Act. So it took a while for that to come to, but today you talk to anyone, no one, that's a sacred area. We don't touch it, we don't talk about it. I personally believe that that's exactly what's going to happen with the Affordable Care Act. Is it fully cooked? I don't think so on many fronts. But is it the humane thing to do? Does every citizen in this country have the right to access to health care? I think that is a right and we should all have that. No one in this country should be without access to care. I think it's a travesty not to be able to have access. So I struggle with the fact that we have to work through this out, work through the wrinkles. A lot of them are more procedural wrinkles than actual issues of access and implementation. I listen to the critics a lot, and I listen to them because that helps me gauge where a good portion of the community is getting their information from. So got to make sure that I try to be as articulate and as informative to make sure that folks have this information. So that at the end of the day, you can make an informed decision and not continue to make the decisions with very little knowledge. I mean, Steve and I were talking a little while ago. If you think about this, we are, as a society, we are insurance illiterate. How many of us read our rental, home, auto insurances, front to back, that is, front to back, and especially the fine print, because I think we would rethink how, in our negotiations. So this is an opportunity for us as a society also to become a little bit more educated about our health and how we're going to access our health. So it has more pluses than minuses, I'd have to say.
So another question over here.
This is probably mostly a Kelvin question, but probably also for all three of you. It seems like the pace of enrollment is quite good in New York State. With the objective of having 1.1 million people enrolled through this system, where does that leave us as a state in terms of addressing the issue of people being uninsured or underinsured? That's really sort of looking 3 years out, where will we be?
Where will be three? Okay. So again, referring back to the slide of initial implementation for us, we're thinking in the first 2.5 to 3 years that we'll have about 1.1 million people who are enrolled through New York State of Health. This work is not going to end then. It's just a starting point for us. So we'll be continuing to do this work. We know that there are certainly more New Yorkers who need to be insured. What's going to motivate people to come to the marketplace to find coverage if they don't have coverage? Some may be motivated by the penalties, which will continue to increase, but also just speaking to the point that you just heard, that as this begins to settle for people, that this is something that's good and that it's working. We think that more people will naturally come into the flow here. But yeah, things are going pretty well right now. We have a good pace, as you just heard. This week. I was just hearing this morning just kind of how the volume has been last week even compared to this week. But certainly this week we've seen quite a few people coming in. So we've also recently launched some advertisements that deal with the January 1 effective coverage. So now advertising December 23rd as the date by which people need to enroll in a plan. So I think that's also driving people. So right after Thanksgiving, we see the volume is increasing quite a bit. So, but I think we'll be in a good place. We can get to the 1.1 million. We know there's more work to do. It's not that we're going to rest there. We know that this work will continue.
I'll put it in context of Tompkins County. So we have 103,000 people here. If you look at the population between 18 and 65, because most children under 18 in this state either have, in our county, either have coverage or have covered through Child Health Plus. So there's a big coverage in that. So 18 to 65, we have about 9,800 people who don't have health insurance. And we hope through this to get about that down to about 4,000 in the first 2 years, I think is the goal that we're setting locally.
Question up front.
How much is the taxpayer supporting people that are getting these breaks supposedly on insurance? And how do you find the person that doesn't work, runs to the emergency room every time he gets a hangnail and doesn't have insurance?
Well, I guess I would say that from my point of view, the concept of this law was that if you get more people into the health insurance system, that you have a bigger pool, and that the pool helps. So, I mean, I went for many, many years essentially never using my health insurance, right? Yeah, you know, I saw the doctor annually, and everything was great, and then God cursed me with kidney stones. So, and there you are. So now I see the doctor all the time. So, you know, and that's the balance of how the pool works, is that I paid all those years and I didn't use it, and now I'm using more than I'm paying in probably. So that's the concept, and that we knew, as I think it was Kelvin's charts, or maybe Dennis's, that showed how that number of people uninsured has risen over these last years, and that's because of the double-digit increases in health insurance. More and more people just couldn't afford it, and more employers stopped offering it. I mean, I saw a lot of my members, small businesses, just get out of the business. They said, I can't offer this. I mean, I saw at the chamber, my agent would come in and say, it's only 17% increase this year. I'm like, and I was supposed to be delighted, right? And that happened all the time. So, so that's the concept, is that's how this will work. And that really depends on people getting in. So I think that's the answer.
And one of the important parts of that, I mean, one of the reasons that we were so interested in this event, thinking that we were going to, I mentioned a young adult audience, you know, certainly if we have only older and sicker populations enrolling, you know, you expect that's going to drive the cost up. So it's very important that we get younger, healthier people to enroll as well. And so, you know, we have efforts and working with organizations like the Young Invincibles, again, to kind of help to drive younger, healthier populations to the marketplace as well. And certainly we know that as New Yorkers, for instance, I mean, we're all paying, those of us who pay for insurance, we're paying higher premiums today to support charity care that individuals without insurance are receiving. I think it's about $600 or $800 a year that each
It's more.
that we're paying in New York State.
Oh, I'm sorry. Yes.
I think it's about $600 or $800 a year that's been estimated that each of us are paying additional costs towards our premiums to support charity care. And then just thinking about the, you know, in New York State for an individual today trying to purchase insurance in the direct pay market, premiums are about $1,200 to $1,300 a month. Quite expensive. Not too many people can afford it. And so, as you can imagine, those who are paying for it are those who really need it because they have those conditions, and it just becomes this cycle that continues to drive things up. So it's a little cost shifting going on for sure, but certainly if we can get a more balanced pool of people in the insurance marketplace, we think that we'll have a better situation. So, but we're all, again, the point is we're all already helping to cover the costs for the uninsured or underinsured. And certainly for those who do go to, you know, who remain uninsured and go to an emergency room, again, with many of the hospitals now coming on board as having staff who are trained as certified application counselors, certainly they will be focused on getting those people enrolled in a plan somehow.
Okay, question in the back. Yep, in the red shirt.
Just wondering what the average premium in Tompkins County or higher.
Question was, why were the premiums higher for Tompkins County?
Okay. Well, first of all, insurance rates are set by county, so that there's a whole lot that goes into that, you know, risk pools and all of that sort of stuff. Population density, all of these types of things go into, I'm not an actuary, but there are a lot of things that go into the setting of rates, but they differ, rates do differ by county. So that's, I mean, I think that's probably the basic explanation there is there are differing rates by county.
Yeah, it is interesting because Tompkins County is, there are these health, there are studies that show what counties are healthier, and Tompkins County actually comes out as one of the healthiest counties in New York, the second healthiest. But our rates are higher, and I have no idea why. I mean, we have a lot of doctors, we have a hospital, so I'm really not quite sure why, but they have been higher traditionally.
Question?
Your speculation is that they're that high because people will pay that, essentially. And, you know, and I wish I knew, but I have no idea. But as Dennis said at the beginning, insurance companies have to show that they're spending 85% or so of what they collect on healthcare. And if they don't do that, they have to give the money back to the people who paid in. So, and nobody in this county got that money back last year. There were some counties downstate that I saw monies goes back to. So if they're collecting it, we're spending it.
We've approached 8 o'clock. Are there any other questions from the audience? Anyone that I missed their hand going up? Well, let's give our speakers a big thank you. Yay. And I also want to say thank you to the TC3 students that are running all of the IT for us this evening. You've done a great job. Thank you very much. And I know some of you have very specific questions for our speakers, and I know that they're willing to stick around and answer those questions. Yeah. So please feel free to do that. And again, thank you all for coming out. And thank you for all the people that joined us live streaming, as well as those who will join us in the video taped issue. Thank you.